I always felt like there was something wrong. I mean, I wasn't sick or anything during pregnancy. I didn't have any problems. I just didn't feel right about the pregnancy.
Welcome to Diagnose This, where future doctors come to think differently so you don't miss what others did. In this series, you'll explore real patient cases that stumped even experienced physicians. As you watch, focus on how the patient is described. Remember, on your exams, you won't see the patient, you'll read the vignette. So train your mind to visualize, connect the dots, and think clinically. Grab your notes, sharpen your instincts, and let's see if you can diagnose this.
In 2002, Bobby and Kelly DeQuara were expecting their second child. Kelly was excited but nervous.
I just always felt like there was something wrong. I mean, I wasn't sick or anything during pregnancy. I didn't have any problems. I just didn't feel right about the pregnancy.
On September 13th, 2002, baby Haley was born at 7 pounds, 7 ounces.
She looked pretty normal when she was born.
I thought she looked beautiful. It was my daughter, so she was perfect.
The first moment that I really knew something was wrong was, I would say, after her first night in the hospital with the breathing. She was just breathing very heavy, and she had a lot of congestion, and you could hear it in the back of her nose and her throat. She would snore. I mean, she was an infant, and she was snoring as loud as her father.
In addition to the congestion, Kelly was struck by some of Haley's facial features, which seemed unusual.
Haley really didn't look like a normal newborn to me. Her eyes seemed too far apart for me, and her forehead seemed very high. It seemed almost rounded. I mean, it protruded out.
While we were in the hospital, she had taken her hearing test, newborn hearing screening, and she failed it.
The doctor came in and explained that she probably failed the test because of the congestion. I just felt like something was going on, and I just didn't know what it was.
But with the exception of the hearing exam, Haley checked out okay, and the doctors sent her home the next morning.
We went for her 2-week checkup. She was growing fine, but she still had the congestion, and her pediatrician thought that maybe she had a cold.
I saw Haley since birth. During my physical examinations, other than the congestion when she came because of that, she was developing as a normal baby.
The first time I saw Haley was at her first baptism. I noticed that Haley's eyes were a little bit more further apart than most children. She almost had a Down syndrome look about her face.
When Haley was 3 weeks old, her congestion got worse. Then she developed a high fever. Alarmed, her parents rushed her to the emergency room.
They took a chest x-ray.
When Kelly saw the chest x-ray, she almost immediately noticed it wasn't right.
And we saw that her lungs were clear, but her rib cage was shaped almost like a pigeon's chest. She was very small at the top, and she widened out at the bottom. And I said, well, what's the matter with the shape of her chest? And they said, there's nothing wrong with the shape of her chest.
The doctors were assuring us that everything was okay. I'm a firm believer in doctors.
The x-rays showed no abnormality in Haley's lung development. Again, the doctors suspected she was simply fighting off a cold or flu and sent her home. But by the time she was 2 months old, Haley's breathing difficulties weren't the only problem.
Babies are normally very flexible. Haley just seemed stiff. Almost looked like she was wearing a neck brace.
You couldn't lift her arms up above shoulder height. I always felt like I was going to break her arms trying to put them in the t-shirts. And we were told that it was just, she needs to just start stretching out a little bit, and she'll do it in time.
She was getting fever a lot. She got many different ear infections.
Kelly was continually going to these doctors. Some people might think, oh, you're just grabbing, you just want something to be wrong with your baby. But I could tell in the tone of her voice, it was just a true concern.
I started to think that, Bobby thought that maybe I was just losing it a little bit.
I really didn't think there was anything seriously wrong. I just thought she had a lot of little things wrong.
Despite her husband's faith, Kelly couldn't shake the feeling that something was seriously wrong with their daughter. And soon it became even harder to ignore.
When Haley was 3 months old, and I noticed that she had a curve in the base of her spine. And it became a little more prominent as the weeks went by. So we decided that we would take her to the orthopedist.
And he said there was a curvature of her spine. It wasn't normal, but not a major problem.
He showed us on the x-rays that he took that she had 2 misshapen vertebrae. It just wasn't one thing anymore. It was just, I was so afraid to go to another doctor because I was afraid every time we went, there was something new.
You know, we were bopping around. You know, we were going from doctor to doctor to doctor, pediatrician, the GI specialist, the ENT, the gastroenterologist, the orthopedic specialist, the cardiologist, emergency room visits.
Then, at 6 months, Haley developed another baffling symptom.
We noticed that, with light, she would squint her eyes, And if you took pictures, she would just squint a lot.
I always attributed that to taking after her father because I was always that way when I was younger.
But as time went by, it seemed to get worse.
I noticed that the light was bothering her. I noticed a little bit of tearing coming from Haley's eye. And there was like some haziness that I noticed in the eyes.
Dr. Gomez, who had known Haley since birth, suggested they take her to an eye doctor.
When we were going to the ophthalmologist, we really didn't feel that it was tied in any respect to, what was going on previous to this. The ophthalmologist had noticed that there was clouding of the cornea.
So she said to us that, it could be glaucoma.
When you hear glaucoma, it makes you think of people in the 70s, 80s, 90s. When you hear about a 7-month-old child having glaucoma, it just didn't sit right with me. Everything else I felt that she could grow out of. That was, I guess, my point where I felt that there was something wrong at that point, I guess, myself.
The test results were inconclusive, so the DeQuaras made appointments with more specialists. But it was during a routine visit with Dr. Gomez that they received some shocking news.
The doctor handed me a fax, and I looked at the page, and the first words that I saw were debilitating and fatal. And I said to him, well, what is this? And he said, well, the ophthalmologist faxed it over to me.
Haley's ophthalmologist had received a fax about a new drug trial for a progressive genetic disorder called Hurler syndrome. The description reminded her of the DeQuara baby, so she forwarded the information to Dr. Gomez.
He said, she could have this. And I'm looking down the list of symptoms, and she had every symptom that was on there.
Patients with Hurler syndrome cannot produce an enzyme that breaks down sugar molecules. The buildup of those sugar molecules in the body can cause abnormal development in the heart, brain, and liver, as well as the eyes, bones, and ears. The disease is deadly and extremely rare, affecting only 1 in 100,000 people. Left untreated, children who are severely affected can die by the age of 5 or 6.
Kelly kept saying that she's got this. Everything that's on that page, she has.
I was not 100% sure that Haley has Hurler's disease. I told her, no, Mrs. DeQuara, still we have to see the genetics doctor because we don't know now.
And I'm like, I don't think she's got it. The chances of her having it are so remote, I don't think that she's got it.
The next week, Kelly and Bobby took Haley to see a geneticist, Dr. Joyce Fox, an expert on Hurler syndrome.
I remember she was sitting in her mother's lap, reaching for toys and playing like any 8-month-old would play. But there were some subtle features about her that as a geneticist I was concerned about.
Those subtle features included Haley's facial appearance, corneal clouding, rounded back, and history of ear infections and congestion.
She examined Haley. She took blood and urine. But just the way she looked at her, the way she was examining her, I knew she thought she had it.
I was concerned that indeed she did have Hurler syndrome, but to wait until the results were in.
There was a pretty good chance that my daughter was going to die by the time She was fine.
The DeQuaras were devastated when they learned that their daughter Haley might have a rare and deadly genetic disorder called Hurler syndrome. But they couldn't be certain until they got the results of her blood and urine tests.
Dr. Fox had called our house, and Kelly had answered the phone.
And I said, well, do you have the results? And she said, well, they came back positive. Haley has Hurler.
And immediately, Kelly melted and couldn't talk anymore.
So I said, okay, 1 minute. And I handed Bobby the phone. And I walked out of the room. Excuse me.
After getting off the phone with her, that's when it really hit me. And I started crying.
When I came back in, he was crying. I think that was one of the scariest points of all of this, because he is such an optimist, and to see him cry meant he knew something was wrong, and if he was crying, then it was real.
We just held each other and realized that now we know where we were going the last 8.5 months. Now everything makes sense. Now we have to figure out, what are we gonna do?
Because for 8 months, they were telling me there was nothing wrong with my baby. And then they told me she was gonna die.
There was no definitive cure for Hurler syndrome, but the DeQuaras soon learned of an experimental treatment at Duke University called a cord blood transplant. It could possibly stop the progress of the disease.
Well, when I first met Haley, she was about 10 and a half months old, and she really looked like a typical child of that age with Hurler syndrome.
Hurler is also called gargoylism. If the treatment didn't work, Haley would face a devastating future.
The disease was called gargoylism because the children looked like gargoyles. What would have happened is that she would have gradually shown more and more developmental delay. She would have had trouble walking if she ever walked. She would have lost vision and hearing. Her face would have gotten more abnormal. These children really become chronically ill until they usually go into heart failure and die.
In a last-ditch effort to save baby Haley, Dr. Kurtzberg would attempt to transplant blood cells from a newborn baby's umbilical cord and placenta.
The transplant gives them a new factory of cells that can manufacture the enzyme that their body can't make.
10 days after they arrived at Duke, Haley was matched to a donor, but her troubles were far from over.
We were told that there was a good possibility that she could die going through the transplant.
But at the end of the day, when faced with one definite bad outcome and one that gave her the chance at having a good life, they felt like they had to take that chance.
Getting Haley ready for the transplant was a dangerous process in itself. She was treated with high-dose chemotherapy that destroyed her immune system and left her vulnerable to a fatal infection.
You hate like hell doing something like that to your child, because you know that they're in for a lot of hurt. You know that it's either you do this or she's going to die.
After 9 days of agonizing chemo, Haley, looking frailer than ever, was finally ready.
Haley's transplant day was August 1st, 2003. She was 11 months old. We put her in her pink dress. We all made a big day of it, and it was actually a really great day, and Haley slept through most of it.
It really is a very simple procedure where they basically just give her a blood transfusion, and that's the beginning of her new life.
The transplant was a success. Now all the DeQuaras could do was wait to see if it would work.
The worst possible scenario is that the transplant doesn't take.
During the stay down there, we saw a lot of kids pass away. It was just very scary to know that there was another child with her disorder and to see her not make it.
None of us even really called each other because you're almost afraid that you would jinx it. You just kind of wanted to wait for that phone call from Bobby and Kelly saying, you know what, everything went okay.
Haley DeQuara was suffering from a rare and fatal disease known as Hurler. After watching their daughter go through a traumatic cord blood transplant, Kelly and Bobby could only wait to see if it would work.
They told us that her body was now making the enzyme that she wasn't making on her own before. So we knew that the transplant was working.
Haley was 100 days out and she was healthy. You couldn't be happier that you went down with a child that was facing death and you came back with a child that's facing life.
Haley was lucky to be diagnosed under a year of age because many children with Hurler are not diagnosed till they're older. So Haley had a better chance of really completely normalizing her life.
She's walking, she's babbling, she's babbling around the house. She really is such a beautiful, strong little girl.
We don't know what the future holds for her, but we believe that she will live a long, happy life.
All right, how did you do? Drop a comment below and let us know. At what point did you first suspect the diagnosis? What were the key clues that tipped you off? If you didn't get it, don't worry. Even experienced physicians have missed these rare or tricky cases. Although they missed it, you won't. This is where future doctors come to think differently. If you need help to build strong, personalized systems for USMLE success, check out USMLE StepMate. We've got the structure, support, and strategy you need to turn clinical clues into exam confidence. Like and be sure to subscribe if you'd like more content like this.